In this video we're going to provide for you 25 useful ways coping with chronic pain and depression. Now, before moving on with the video, let me ask you first. What is chronic pain? For some people, pain can be ongoing or go away and then come back, lasting beyond the usual course of 3 to 6 months. This is called chronic pain or persistent pain. Chronic pain is often associated with other health conditions such as anxiety and depression. Here, we are providing 25 useful ways in overcoming chronic pain and depression. Point number 1. Early diagnosis of depression. Talking to a physician about symptoms of depression, while still in the acute pain phase of pain, can alert a physician to the need to consider treatment of both conditions. An informed physician can suggest a treatment plan early on that treats the patient's depression as well as their physical pain, giving the patient the best chance at a positive outcome. Point number 2. Identify triggers. Identifying stress triggers or emotional triggers that affect the pain is the first step in helping manage pain, at least in part, by avoiding or eliminating specific stress triggers. Patients can monitor how their own stress and anxiety affects their back pain by keeping a diary of when their back pain changes and what kinds of stress could be triggering the pain. Point number 3. Communicate with others. Depression and an emotional reaction to chronic pain are to be expected, they are understandable. Many patients do not speak to their physicians about their depression because they believe that once the initial pain problem is resolved, the depression, anxiety, and stress they are feeling will go away. Point number 4. Seek multidisciplinary care. A multidisciplinary course of treatment that involving both a physician and a mental health professional can often provide the best outcomes. With a team approach, both the pain problem and the depression are monitored simultaneously, and both doctors can communicate about how each area affects the other. Point number 5. Eat balanced diet. A balanced diet supplies the nutrients your body needs to work effectively. A balanced diet is a diet that contains calories, proteins, minerals, vitamins, and alternative nutrients in adequate amount, and a small provision is reserved for additional nutrients to endure the short length of leanness. Point number 6. Get sleep. Sleep deprivation can disrupt our cognitive functions and exacerbate depression and anxiety. Excessive stress can make it hard to sleep at night, so it's so common for people going through stressful situations to suffer from chronic pain and depression. Try not to look at your phone before you go to sleep and take a warm shower before jumping into bed. Point number 7. Exercise to fight chronic pain. There's an abundance of research that regular physical activity boosts mood and alleviates anxiety, but less evidence about its impact on pain. Aerobic exercise, performed at the intensity recommended for maintaining heart and respiratory fitness, improved overall well-being and physical function in patients with fibromyalgia, and might alleviate pain. Point number 8. Peer support. Many people find that support groups for chronic pain, mental illness, or both can provide both emotional support and psychoeducation. If there isn't an in-person group in your area, consider looking online for support. Point number 9. Relaxation training. Various techniques can help people to relax and reduce the stress response. Stress tends to exacerbate pain as well as symptoms of anxiety and depression. Techniques include progressive muscle relaxation, yoga, and mindfulness training. Point number 10. Set realistic goals. Goals often differ for acute and chronic pain, but still focus on prevention, pain relief, and function. Goals for pain management should be specific, measurable, and patient-centered. It is both unrealistic and undesirable to cast no pain as a treatment goal. Point number 11. Volunteer yourself. Volunteering to help others, especially regularly over time. Taking on a giving role can change self-perceptions and boost mood levels. Point number 12. Lighten yourself. Increasing time spent outdoors during daylight can help prevent seasonal affective disorder, SAD, as can the use of a light box. Depression is linked to insufficient vitamin D levels, which can be boosted by regular exposure to UV light. Point number 13. Stress management. Avoiding excessive stress, especially chronic stress. Of course, all stress cannot be avoided. Small projects that bring on temporary stress are preferable to massive undertakings that bring on long-term, chronic stress. Point number 14. Spiritual healing. Prayer, meditation, or spiritual study seems to boost mood and sense of well-being. Spiritual healers believe that the therapeutic effect results from the channeling of healing energy from an assumed source via the healer to the patient. Point number 15. Avoid negativity. People who suffer from chronic arthritis pain and depression may want to steer clear of TV shows and other media with negative themes. In one study, experts interviewed many older adults who reported that watching TV shows with negative themes contributed to a deteriorated mood. Point number 16. Feel moved by fascination. Treat the senses to rich and meaningful forms of beauty, such as listening to music, spending time outdoors, or participating in the arts. It is important to choose activities that appeal to one's unique interests and passions. If there is a lack of interest, there will be a lack of motivation. Point number 17. Go with flow. Keeping occupied, preferably with something that allows one to experience flow in the work. Researchers have found the arts, crafting, and performing home repairs, for example, can stimulate the neurological system and enhance overall health and feelings of well-being. Point number 18. Inpatient and outpatient pain programs. More intensive programs can provide immediate and long-term support when depression and/or chronic pain is severe. These programs typically provide on-site medical support, individual and group therapy, and psychoeducation for reducing stress and pain. Point number 19. Antidepressant medication. A variety of antidepressants are prescribed for both anxiety and depression. Some of these also help alleviate nerve pain. The research most strongly supports the use of serotonin and norepinephrine reuptake inhibitors, SNRIs, or tricyclic antidepressants, TCAS, as double-duty drugs that can treat both psychiatric disorders and pain. TCAS' most serious side effect is a dangerously abnormal heart rhythm, so these drugs may not be appropriate for people with heart disease. Point number 20. Mood stabilizer. Anticonvulsants are also sometimes used to stabilize mood. These medications exert their effects by constraining aberrant electrical activity and hyperresponsiveness in the brain, which contributes to seizures. Because chronic pain in particular involves nerve hypersensitivity, some of these medications may provide relief. Point number 21. Stress reduction skills. Stress management or skills can include exercise, muscle relaxation, meditation, positive thinking, etc. Therapists, pain specialists, physical therapists and others can provide recommendations to fit the needs and interests of the patient. Point number 22. Talk therapy. Talk therapy can help an individual change patterns in thinking, learn coping skills for symptoms, and help prevent future depressive symptoms. Point number 23. Pain rehabilitation program. Pain rehabilitation programs typically provide a team approach to treatment, including medical and psychiatric aspects. Point number 24. Cognitive behavioral therapy. Pain is demoralizing as well as hurtful. Cognitive behavioral therapy, CBT, is not only an established treatment for anxiety and depression, it is also the best studied psychotherapy for treating pain. Therapists use CBT to help patients learn coping skills so that they can manage, rather than be victimized by, their pain. Point number 25. Hypnosis. During this therapy, a clinician helps a patient achieve a trance-like state and then provides positive suggestions, for instance, that pain will improve. Some patients can also learn self-hypnosis. One study showed that hypnosis training reduced both gastrointestinal distress and levels of depression and anxiety in 71% of those studied. Do like our video and share it with your friends and family. It might help someone relieve their chronic pain. That's all, folks. Stay healthy. Stay beautiful.